So I'm going to pretend to be a new patient who's curious. Let's call my AI team. Ready?
This is Angelica from Next Gen Care. How can I help you today?
Yeah, hi there. I've been having a lot of back pain, and I just wanted to see if I could, I don't know, see somebody about this.
Oh no, I'm sorry to hear about your back pain. We can absolutely help you with that. Have you been to our clinic before, or would this be your first time visiting us?
Never been there.
All right, well, we're absolutely welcoming new patients. Would you like to schedule a new patient evaluation?
I would, but I have a few questions first. I'm wondering, do you all accept my insurance?
Absolutely. I get that question often. Could you please tell me the name of your insurance provider?
It's Anthem Blue Cross.
Great. We do work with Anthem Blue Cross as an out-of-network insurance. If you could send us the front and back of your insurance card to our email at frontdesk@helpcare.ai, we can do a detailed verification for you. That
Okay.
sound good?
Yeah, that sounds great. Honestly, that's great. Question, what kinds of treatments do you all offer at the clinic?
Oh yes, of course. We offer a range of treatments, including chiropractic adjustments, class IV laser therapy, acupuncture, deep tissue mobilization, muscle stem therapy, massage therapy, lumbar flexion therapy, non-surgical spinal decompression, and stretches and exercises. We're an integrative chiropractic clinic, so we really aim to give you comprehensive care. Does that cover what you're looking for?
Yeah, it sure does. I'm wondering, have you guys been around for long? Have the doctors been there? How much experience do they have?
Oh, absolutely. We have a team of 4 chiropractors. One of them has been practicing since 2003. They all do annual relicensing and weekly training sessions as a group, so you'll benefit from the combined experience of all our doctors. You'll be in good hands here.
That's great. Okay, no, that's good. Yeah, I'd like to schedule a new patient appointment if possible.
Of course, let's see. We have available slots starting next week. I have Tuesday, August 6th at 11 a.m. and 11:30 a.m. with Dr. Parvini, and also Wednesday, August 7th at 10 a.m., 11 a.m., or 1 p.m. with Dr. Brooks. Which one works for you?
I'd like to see Dr. Parvini for that second time slot.
Perfect. That's Tuesday, August 6th at 11:30 a.m. with Dr. Parvini. Let's go ahead and collect some information from you. Can you please spell your first name and last name?
Yeah, my name is Arush Singh, and that's spelled Aarush, and my last name Singh is Singh.
Got it. Thank you, Arush. Can I have your email address and phone number, please?
Yeah, it's my first name and last name 123@gmail.com.
All right, Arush. So your email is aarushsingh123@gmail.com. And your phone number?
It is area code 650-222-3333.
Thank you. Your phone number is area code 650-222-3333. So you're all set for Tuesday, August 6th at 11:30 a.m. with Dr. Parvini. Would you like me to send you a reminder text and a calendar invite?
Yeah, that would be great. I'd appreciate that.
Of course, I'll send that right away. Would you like to hear what to expect during your first visit?
Sure, tell me, what's that first visit like?
Well, as a new patient, you'll have a 60 to 90-minute exam. The doctor will perform orthopedic tests, balance evaluations, range of motion testing, and take a detailed health history. If needed, there might be x-rays. We recommend wearing loose clothing and arriving 15 minutes before your appointment time. Does that make sense?
Yeah, that really works. That's fantastic. I can do that.
Great. Also, please remember to bring your insurance information and an ID. Do you know our address?
Yeah, I have it. It's right here on your site.
Perfect. You're all set, Arish. Looking forward to seeing you on August 6th at 11:30 a.m. with Dr. Parvini. If you have any further questions, feel free to call us. Have a wonderful day.
Awesome. Thanks a lot. Appreciate it.
Absolutely. Take care and see you soon.
All right. Bye-bye. That's awesome. Fantastic. Okay. If only I had Angelica years ago. Now, let's see if we can see what the real-time data input is. I want to see how she does this. Okay. Let's see if Angelica has scheduled it. Now, I have a private login for Angelica, so I can see exactly what she's doing in the EMR. Since she's confirmed all the information with the patient, Angelica has a 99.99% accuracy. How she notes all of that. Logged in. Name is spelled right. Now, at our clinic, we like to know all the details of every call. Let's see how she notes all of that. Awesome. Now, I've only had Angelica for a few days, and she's doing amazing. But I want to call my chief of staff, Hannah, for an evaluation of not only the practice, but to see how Angelica is doing. All right, let's see if I can click in and talk with Hannah.
Hi, Dr. Parvini. How are you doing today?
I'm doing well, thanks, Hannah. I was wondering how the clinic is doing today.
It was a busy day, but no complaints. busy is good.
It's true, yeah. So, Hannah, I know Angelica's only been with us for roughly a week, and I'd like you to tell me a little bit about how she's handling patient communication and phone calls.
Absolutely. Angelica has been doing a fantastic job so far. In just 6 days, she's taken a total of 120 calls. That's quite impressive, isn't it?
Yeah, that is. Now, can you break that down for me? Tell me what types of calls they were and maybe the numbers?
Absolutely. Here's the breakdown for you. 5 requests for medical records, 11 clinic, non-medical questions, 8 potential new patients asking about services and costs, 8 sales or spam calls, 9 miscellaneous calls.
Yeah, and can you tell me how many new patients were scheduled and how many existing patients had questions about their existing schedules?
Of course, Angelica booked 17 new patient appointments, 9 during business hours and 8 during off hours. How great is that? Additionally, 21 rescheduled or changed their appointments. Glad we got those taken care of early.
And can you tell me how much time did we save our staff on these phone calls?
Absolutely. Overall, Angelica spent 8 hours and 27 minutes on calls. During clinic hours, she spent 3 hours and 1 minute. And after clinic hours, it was 5 hours and 26 minutes. From the new patients alone, we generated $4,930. Rescheduling or appointment changes brought in an additional $1,470. So, all in all, Angelica's efficiency has really paid off for us.
Okay, that's great. That's how much time we saved our staff. Let me ask you, how much time did we save our patients so they didn't have to wait for a phone call like the next day?
Oh, absolutely. Angelica managed to capture 14 simultaneous calls. Normally, 7 of those calls would have gone to overflow messaging. But thanks to Angelica, all those calls were handled promptly.
Okay. Now, we're a small clinic, and even we get simultaneous calls, but let's say we were a team of 25 or 50 or hundreds of healthcare providers. Could you and the team handle all of those simultaneously?
You know it, Doc. We're more than capable of handling a larger team. Angelica and I are ready to scale up as needed.
That's awesome. I have one last question. I think you're doing great so far. And tomorrow, I'd like to ask you to maybe have a conversation with David. And what I'd like you and David to do is to look through my entire patient database. I know we're keeping an eye on quality measures, and overall, we're doing really well. But this quarter, our prime focus is access and growth with very specific populations. We need to get approximately 40 additional patient screenings in this month in our department to hit our quality and growth goals without stressing out our existing staff. So, Hannah, can you do that for me?
Very doable. I'll create a detailed message, lay out the parameters for David, including timeframes based on urgency. He'll generate the data set, and I'll create the plan. Then, I'll ask Angelica to deploy. I anticipate 100 outgoing customized calls to patients tomorrow morning. I'll make sure to stop the calls as soon as we either make our target goal or our schedule is booked. Is that a good plan?
Yeah, that's actually perfect. And when do you anticipate that this will be completed?
I'm already working on it now. We'll have it done by noon tomorrow. I'll send you an update with results and any challenges we encounter.
That's incredible. Thanks, Hannah. Maybe we'll chat again tomorrow.
Absolutely.
Fantastic. And that's my new team.